Hi, my name is Jason Bennett. I'm the Athletic Training Program Director here at Cal State Fullerton. I'm here today to talk to you about the healthcare profession of athletic training. Athletic training is recognized by the American Medical Association as an allied healthcare profession. This recognition came in 1991, so as healthcare professions go in the U.S., it's relatively young, but we've been around since 1950. Now, athletic trainers are those that practice athletic training, and they are healthcare professionals who render service or treatment under the direction of or in collaboration with a physician, in according to their education and training in the state statutes, rules, and regulations. And that's a great definition, but it really doesn't tell us what athletic trainers do. So let's talk about the services that what athletic trainers provide. So we really have 5 areas or domains where athletic trainers practice. First one is what they do is injury and illness prevention and wellness promotion. We're really one of the few healthcare professions that focus on injury prevention. And we'll talk a little bit more about that when we talk about orthopedic injuries and prevention. But these pictures here I wanted to outline for you as far as the top picture is a group practicing their emergency action plan of what they would do in case a patient develops heat stroke. And heat stroke is one of the leading causes of death in athletics, and unfortunately that those deaths happen because it's 100% preventable. And one of the ways by doing that is by developing an emergency action plan, but as well as practicing these things where, in this case, in this picture, they're putting a patient in a tarp and then putting cold water on the patient in the tarp and trying to reduce their core body temperature. It's actually one of the few times in an emergency situation we don't try to transport them to the nearest emergency room because that delay in time allows the body temperature to continue to rise. So we're trying to decrease that body temperature down to about 102 degrees to get them out of that danger zone. The bottom picture here actually shows an athletic trainer working with a patient as they go through some baseline testing, some computerized neuropsychological testing for concussion. And basically what we do is we try to develop an objective way to determine if someone is symptomatic or is not, their brain is not functioning as well after concussion. And what we do is we compare their scores on this computerized test from before when they were not concussed to the scores that they have after. And that way we can determine is their brain functioning equal to was before, or is it still depressed after concussion. Another area that athletic trainers work is within examination, assessment, and diagnosis. We do a lot of orthopedic evaluations. These 2 pictures here, the top picture is an athletic trainer working with a patient on the field. Looks like they're evaluating a knee injury. Looks like they're assessing for either an anterior cruciate ligament or a posterior cruciate ligament within the knee. And the bottom picture here is an athletic trainer working with an athlete or a patient that has he's doing a concussion assessment, and you can see with her black eye she must have had some pretty good blunt force trauma to their face, and with that sometimes comes concussions. Again, another area is immediate and emergency care, and this is probably what most people think of when they think of athletic trainers, and that's where if you're watching football on a Saturday or Sunday and you see someone get injured and you see the people go out there to determine the severity of that injury, those are athletic trainers. And so this is a picture on the top. I think this is Northwestern University evaluating this football player acutely on the field. And then on the bottom is University of Florida, the athletic trainer there. They suspected a cervical spine or some sort of spine injury, and so they did spine boarding and immobilization and then transport to the emergency room for further diagnostic evaluation. In addition, athletic trainers do therapeutic intervention, so we do a lot of treatments and rehabilitations, especially of orthopedic injuries. And we can see the picture on the top is an athletic trainer working with a patient. Looks like post-knee injury because she has a good solid knee brace on there, and they're working on some proprioception and some rehabilitation techniques there. The bottom picture is an athletic trainer applying therapeutic ultrasound during the rehab process. So very similar in that aspect, very similar to a physical therapist, but physical therapists will work with a greater variety of patients. Usually athletic trainers are typically working with orthopedic injuries, bones, muscles, ligaments. Those are kind of what we're working with, a lot of musculoskeletal injuries and certainly some neurological injuries as well. And then the last area that where athletic trainers provide service is really in the healthcare administration and their professional responsibility. So athletic trainers definitely work as a collaborative team of healthcare professionals. So we work with physicians, we work under the guidance and supervision of a physician, but we also interact with a lot of other allied healthcare professionals, whether it's physical therapists, sports psychologists, nutritionists, and then certainly we have to interact and talk with patients, and if the patient is under 18, with parents, with insurance companies. So there's a lot of administration and communication that are required for athletic trainers. And then the bottom picture there is a workshop. Athletic trainers are required, like a lot of healthcare providers, to obtain CEUs, or continuing education units. They have to get 50 credits every 2 years. And so a lot of times athletic trainers receive these credits by going to workshops, going to conferences. And this is a picture of an athletic trainer learning how to cast. Looks like they're doing a short arm cast there for like a radius fracture or carpal fracture. The casting and bracing is actually a class that I teach. It's actually a fun class. And we're seeing a lot of, because of those extra skills that sometimes people learn as an athletic trainer, they're more marketable in the job placement. Speaking of job placement and employment settings, there's really kind of two areas that I think of when I think of employment settings. One is the traditional setting, which is what most people think of with athletic trainers. And another one is an emerging setting. And this first slide is really those traditional employment settings, which are high schools, colleges and universities, and professional sports. And so the picture on the bottom left is that athletic trainer evaluating a high school football player. The picture in the bottom middle is actually the head athletic trainer here at Cal State Fullerton. That's Julie Max in the middle there, evaluating a knee, but also helping one of our students learn how to evaluate a knee. And then the bottom picture to the right is the athletic trainer there is Gary Vitti. Gary Vitti recently just retired from the Lakers, and he was the athletic trainer that worked for the entire career of Kobe Bryant. So any sort of injury that Kobe had, Gary was right there to assist in rehab. In addition to our traditional settings, we have emerging settings, and these are really kind of the fastest growing settings out there. Certainly hospitals, physician offices, and sports medicine clinics. Sometimes those are referred more to as orthopedic or outpatient physical therapy clinics, hire a lot of athletic trainers. But physician offices as well. There's a lot of research out there that shows that there's greater patient satisfaction that goes to, especially an orthopedic surgeon's office, if there's an athletic trainer there to take the history, do an initial evaluation, and then when the physician comes in to present that injury to the physician continues the evaluation and either confirms or comes up with a different diagnosis. And then when the physician walks out of the room, goes to the next patient, the athletic trainer can stay and talk to the patient and answer any further questions or help them with patient education about their injury. And so we really see a lot of increase in patient satisfaction, as well as increased patient throughput, which is important to physicians, because throughput is the quantity of patients they can see in a day. And so physicians are very happy when hiring athletic trainers, because not only are patients more satisfied, but the physician can see more patients in a day. So it's a win-win all around. The bottom left picture is an athletic trainer working with military recruits. And so we definitely see this as a growing field. In fact, recently in the news was an announcement that the U.S. government is spending, I think, $6.8 million the next year in hiring additional athletic trainers for military. And so these are civilians. You do not have to sign up to be in the military or be a recruit yourself. These are civilians that are athletic trainers that work with these recruits and evaluate their injuries, treat their injuries, rehab their injuries, so they can return to their basic training and continue in their preparation within the military. And as well as law enforcement, we're seeing a lot of more of law enforcement with the police officers and the fire department as well. When they have injuries, we see more and more athletic trainers being hired to evaluate, treat, and rehab those injuries so they can get back to work quickly and safely. Industrial corporate, the picture on the bottom middle, corporations are hiring athletic trainers to work with their workers who see a lot of overuse injuries. And so the athletic trainers can come in and do more ergonomic assessment to make sure that we can prevent those injuries from occurring if they're bending over their back too far when they're doing some sort of skill or whatnot, or just making sure there's good ergonomics there, as well as the treatment and rehab. So it really decreases workman comp costs for the employer, and really a huge return on investment there for commercial and industrial corporate areas. And the last one's performing arts. The picture on the right, that's a picture of an athletic trainer at La Rev, which is a show in Las Vegas. I think La Rev, that show itself, hires or has 3 athletic trainers that work there full time. And you were seeing a lot of shows in Vegas with performing arts that have athletic trainers, as well as just down the road here at Disneyland. Disneyland has at least 17 athletic trainers that work with the performers there and the employees there at Disneyland to treat and rehab those injuries on site. So these emerging settings are not settings that a lot of people think of where an athletic trainer is. This is very much a growing setting. And so we've talked about kind of what athletic trainers do and where they work, but sometimes I think it's best to have a video to show you a greater perspective of the impact that an athletic trainer has. So this is just over a 5-minute video that I want to show for you.
It was 2 weeks before graduation. I was going for a ground ball. Another player was going for a ground ball. Right when it happened, like the whole world looked really bright.
The ref blew the whistle, and I looked back, and Tommy was laying down with his head down. I thought he was going to be fine. I thought it was like a stinger or something.
You know, a pretty mellow hit compared to other hits that I've seen.
When I initially came to him, he was on his knees, bracing his head. You know, my initial instinct is, okay, you know, he has a head injury. You know, I asked him if he had any neck pain. He said no. So I start to go through concussion testing. So I'm asking him, you know, memory questions, recall questions. I'm checking the sensation, like on his face. And that's when he tells me that he can't feel the back of his head. That's a sign of some kind of nerve involvement. And I told Coach Colt, I think we should call the ambulance. And so then a parent came up and he's like, oh, I'm a doctor, you know, can I help you? And I always love a second opinion.
We're trained in medicine to be especially concerned about neck injuries if there's a collision that occurs with the neck flexed. He told me that he was hit from the side, and grossly, neurologically, he was intact. He was moving his toes and his fingers. I was thinking that the likelihood of any kind of serious injury, in particular a neck injury, is pretty low.
It's always in the back of your mind. Calling 911 is this kid in 2 seconds is like, you know what, I feel fine.
I mean, Tommy told me multiple times that he was fine. You know, just let me get up, I'm fine.
For her, I think it was kind of hard because he was trying to get up. And when he tried to get up, I mean, you think everything's fine. But if he would have gotten up, it wouldn't have been good.
20 minutes later, ambulance leaves. We finished the game out, and the first phone call was, you know, Tommy went in the x-rays, everything looks great. So I was like, all right. She's like, don't worry about coming down here. And got the second phone call. But it wasn't really much information. It was, Tommy broke his neck, get down here.
C1 is the very topmost cervical vertebra, and it's basically a ring of bone, and that ring had been burst apart. If the cervical spine is disrupted at that high level, it could actually stop the person from breathing. It certainly could cause quadriplegia.
It was very shocking to hear that, you know, I was holding his head in my hands, and ultimately, you know, that we made the right decision.
There was nothing keeping my head there, so like if I had gotten up, it would have just kind of sunk. I wanted to get up because my mentality has always been, get up, let's play through it, let's keep going. But she was very persistent and made me stay down.
You know, as heroic as the situation seems, I just did what, you know, we're trained to do, ultimately.
The foundation that my mom and I started is called Advocates for Injured Athletes, and our main goal is to put athletic trainers on every field in California.
The professional athletic trainers, the certified athletic trainers, know how to handle these events. They don't just tape ankles and put ice bags on athletes. They handle trauma.
Parents, you know, they think that someone's out there to take care of their kids, and a lot of times that's not the case. There's nothing mandating that athletic trainers are required to be at schools or club sporting events. And even then, there's no legislation that says that athletic trainers have to be licensed or certified.
I mean, there's no reason that a coach, a parent, anyone should have to deal with an injury on the field. I will never coach without a certified athletic trainer again.
If my athletic trainer was not a licensed athletic trainer and didn't have the education that she did, then I might not be sitting here today.
This will happen again. This will happen to somebody. And our goal is really, if we save one life, we save one athlete somehow, somewhere, it's worth it the story be told.
Okay, so that's a great video. I really enjoy that video, and really appreciate what the role of the athletic trainer there in that video and that in situation as well. You know, it's very difficult sometimes when you've got a lot of people telling you that, no, I think this person's okay, and you've got to be the advocate for the patient's safety, especially in athletics, where sometimes people get a little bit lost in what's best for the patient as far as safety goes, and we get a little caught up in winning. The athletic trainer is critical to be there, to be the only person there really for the patient's safety, and the healthcare provider to say this is okay or not okay. So it's a great story and a great impact of what actually athletic trainers do and the impact they have. So getting back to athletic training and talking about job outlook, like most healthcare professions, there's a great projection of growth, certainly 23% over the next 8 years or so. For athletic trainers, and I would say in the state of California, there's a huge growth potential in high school settings, in that traditional settings, because we know there's only about 630 high schools out of 1,757 that have an athletic trainer. So, you know, we're talking about 34% of high schools have an athletic trainer, and so there's a huge growth for that job setting alone. The educational requirements. What's required for students to go to a program and become a certified athletic trainer? My picture's here kind of messed up on the side here, so my apologies. But first thing is that in order to become an athletic trainer, you must go to a CADI accredited program. So there's 300 programs in the country that are accredited. And once you attend and graduate from an accredited program, you're then allowed to then take the National Board of Certification examination, and that's the examination that you need to pass to call yourself a certified athletic trainer, and from there you can be hired. And so you have to go to a CADI accredited program. You've got to pass this BOC exam, and one of the things similar to the recent move in physical therapy over the last 15 years, where they moved to a doctorate of physical therapy, athletic training has moved from a bachelor's degree to a master's degree. And one of the rationale behind that is there, as medicine evolves and knowledge evolves, there's so many things that we have to teach in order to make sure that this person that graduates can handle those situations, like a Tommy Mallon situation, that it's too difficult to teach all those things at the bachelor's degree while the student is still taking GE and basic science courses. So the profession has moved to, it must be a master's degree, because that way we can make sure that we can get into the depth that we need to, as opposed to the bachelor's degree. So for the master's degree, there's no specific undergraduate major required, although most students come out of a kinesiology, exercise science, health science major. They have to complete prerequisite courses. They have to obtain clinical observation hours, and that's very typical of most graduate healthcare professions. They have to obtain CPR and AED certification for the professional rescuer, and they need to take the GRE. And one more thought about the clinical observation hours. Those are really important simply because they're important to allow a prospective student to go and shadow an athletic trainer and determine if this is a good fit for them or not. No different than any other healthcare profession, my biggest recommendation is always to obtain hours in maybe a couple different settings and see if it's a good fit for you. And my analogy is always, it's like shoe shopping. You've got to try shoes on for size and walk around a little bit to see if they fit. You can't just look at them and say that's a great fit for me. So my recommendation is always to get some clinical observation hours and just to see if this seems like a good fit for you. One of the things about the educational requirements with a master's degree, it's the 2-year cohort-based program. So cohort is you bring in one group at one time and they all go through the same classes at the same time. And one of the big differences between athletic training graduate programs and other allied health education programs is that we have students do their clinical experiences in conjunction with their coursework during the same semester. For example, in PA school, a lot of times those are 2-year programs where the first year is very intense academics and the entire second year is all clinicals. Physical therapy does that as well. They might have 2 or 3 semesters of academics and then a semester of clinicals and then a semester of academics and then a semester of clinicals. The difference is in athletic training, we combine those. So we will have classes in the morning where we're learning about content. They'll do their clinicals in the afternoon or early evening, and so they can apply that content right away. And it's really great for feedback. And so that's what this graphic is here. It's great for feedback because, I could talk about evaluating a shoulder in class. They could go to their clinicals that afternoon and there might happen to be a patient that actually comes to them with a shoulder injury, and so they can apply it right away. They can get that feedback from their athletic trainer that they're working under about what to improve, and they can come back to class and they can share that experience, but also it allows them to kind of internalize that information more because they can see the application right away. So what happens is, in my opinion, I think they learn at a greater rate because they can apply these things right away. And it's really a great combination where not only can we start it in class and then learn it clinically, but sometimes you get exposed to things clinically that later on when then you talk about it in class, you can already apply it because you're like, oh, I had a patient that had this. And so you retain things a little bit better in my opinion. So I really like that aspect where we combine clinical experiences each semester they're in the program. I really think that I'm going to skip that slide. One of the, I have to have a plug for Cal State Fullerton. That's my area. So the prerequisites for our program here at Cal State Fullerton are very similar to other healthcare professions as far as the anatomy, physiology, the physics, the chemistry. Although compared to physical therapy, we're just requiring 1 semester of physics and chemistry. We need you to have a good, solid, basic understanding, but we don't need too much detail in that area, but we need to have a good, basic, solid understanding. Certainly psychology. Our experience is that students don't remember a lot from human anatomy, so we want an additional anatomy course. Sometimes at some places that might be a biomechanics class. Here at Cal State Fullerton, we have a movement anatomy course. Medical terminology, exercise physiology, nutrition, and statistics. And then we also require something related to pathologies in sport. At some community colleges, at some universities, that class is called Care and Prevention of Athletic Injuries. And we basically just want this broad-based list of courses to make sure that when the student comes to us in a graduate program, they have a good, basic, solid science foundation, and they're ready to get into the nitty-gritty of things, and so we don't have to teach the background sciences. So we have a lot of prereqs, but we think that really helps our students and our outcomes. Speaking of outcomes, we have an undergraduate program at Fullerton. We are transitioning to a master's degree program. We're have just been told that our master's degree program has been approved at the chancellor's level. So we're planning to start in summer of 2019 for our first cohort. Our goal for our master's degree program is to admit 15 students per year. And if our undergraduate program is any predictor of success, we have a great predictor of success for our graduate program because our undergraduate program basically is 100%. Everyone passes the certification exam on their first attempt. We have 100% student retention, 100% graduation rate, and we have 100% graduate placement rate of getting jobs after they graduate. So this is a great, our program at Cal State Fullerton is second to none. And I think we fly a little bit under the radar because we're those healthcare providers that just do a good job, and we don't really look for the limelight, but we have an extremely quality program here at Cal State Fullerton, looking to continue that at the graduate level. These are just some pictures that I put together. The bottom left here is our group right now, our entire program. We have 12 students in our program right now. We have 3 faculty. We have a picture up here of me teaching a student about a shoulder special test for impingement, a glenohumeral impingement test. We got another faculty teaching student here about knee evaluation. Down here in the bottom right, we have students practicing their emergency skills as far as neck immobilization and spine immobilization. And then this picture up here is really unique for us at Cal State Fullerton. With our nursing program here, we're able to go in and collaborate with our nurses as part of an interprofessional education and work with their simulation mannequins on practicing our evaluation skills of listening to heart sounds and lung sounds, taking vitals. And so it's a really great opportunity that's not typical at most athletic training programs that we do have here at Cal State Fullerton, is working with our nursing students and the nursing faculty in that simulation lab. I was asked to talk about some of the myths that happen with all healthcare professions, and certainly athletic training has their myths as well. And I would say that the name athletic trainer makes people think that we're personal trainers. And that's probably the biggest thing I would like to dispel, is that, a personal trainer is someone that's certainly valuable as far as helping people achieve their fitness goals. But an athletic trainer is a healthcare professional. And so we're not the same things. An athletic trainer, you need to have a master's degree, you need to pass a national certification exam. Personal trainer, you do not. You need to have either one of those. You don't need a degree, you don't need to pass anything. You can call yourself a personal trainer. So we're not the same thing. So because of that, we don't like to be called trainer. We know that sometimes people like to shorten things, and athletic trainer is maybe too long for them, but I would prefer to be called an AT instead of a trainer. Because again, it goes back to that myth of it sounds the same as personal trainer. And then similar to the video that Beth Mellon mentioned, is we do more than tape ankles. Some people think that that's really all we do, and that's just maybe 2% of what we do is tape ankles. But you tend to see that in TV shows or movies of the person taping ankles, and they call them the trainer and whatnot, and that's really not what we do a lot. We do a lot more of a prevention and evaluation of injuries, and obviously that emergency care, like we said, and a lot of rehab and therapeutic intervention, and certainly working as a healthcare team. And then lastly, what I was asked to talk about is just about me. That's the best picture I have of myself. That's as good as it gets. My background in education, I got both my bachelor's and master's at Cal State Chico. I went out to Tennessee to get my doctoral degree so I could be a faculty member. This is actually my first semester here at Cal State Fullerton, here fall of 2018, and very excited to be here. I'm also the president of the California Athletic Trainers Association, so I'm very involved with our governmental efforts for state licensure, and so very involved with the profession. And why I chose AT, I would say that I chose AT for several reasons. One, I really like learning, and in athletic training, you have to learn a lot about a lot. Sometimes people would say that athletic training is a little bit of a physical therapist, a little bit of a orthopedic surgeon, a little bit of a EMT or paramedic. I would say it's also a little bit of a sports psychologist. So we have to know a little bit about a lot, or actually a lot about a lot. And so I like that because you're always learning, and obviously medicine and healthcare changes over time. So there's just always something more to learn, and I like that challenge. So I think that's probably why I chose AT, because it challenges me on a daily basis, and I like that. It's never the same. And so I think that's the big thing for me of why I chose AT and why I love athletic training. It's pretty amazing. So that's pretty much the video here about athletic training. If anybody ever has a question about it, I'm available. You can shoot me an email. My email's on the front slide here. And I'm glad to help anytime I can. Thank you.